Good evening. Welcome to another episode of Aging with Attitude. My name is Phil Koch. I'm the host for this evening. And tonight we have a guest, Stephanine Bias. Stephanine is with us from Raleigh. She is the North Carolina Senior Medicare Patrol Program Coordinator for Seniors Health Insurance Information at the Department of Insurance. Welcome.
Thank you so much, Phil. It's good to be here.
Great to have you. So tell me more about your particular department and how that helps our viewers.
Well, the North Carolina Department of Insurance has several consumer divisions, one of which is very visible to all of the constituents in North Carolina, is the Senior Medicare Patrol Program. And we are housed within the SHIIP division, or the Seniors Health Insurance Information Program, at the Department of Insurance. The S&P program really focuses on Medicare fraud prevention education efforts to help our seniors and our Medicare beneficiaries that are under 65, as well as caregivers, as well as family members, as well as the aging professionals, to understand what would be considered Medicare fraud and how to prevent themselves from becoming a victim.
Great. So is it just on Medicare fraud, or if they had generic questions about Medicare as a whole, could they also call that
They
number?
can also call our number. Our number for the S&P program is 1-877-996-2767, or if they wanted to call our SHIIP line, it is also, you can reach us through that number as well. Right. So, we can answer both sets of questions, but our 877 number is dedicated strictly to reporting what they suspect is Medicare fraud. Yes.
Great.
We coordinate our services also in Charlotte-Mecklenburg through the S&P program coordinates through the Central Carolina Area Agency on Aging, and our SHIIP coordinates our services through the senior centers in Mecklenburg County, as well as the Shepherd Center.
Great. Yeah, I know Gina, Shepherd Center, and you said Gail Woody and Debbie
at the Central Carolina Area Agency on Aging.
That's fantastic. Tell me, give me, if you could, just a couple of quick examples of some calls you might get about Medicare fraud.
Oftentimes our seniors will call us and say, someone called me and they said that they had changes to Medicare that they wanted to tell me about, but they wanted to make sure that I was the person that they were talking with, the Medicare beneficiary, was the person they were talking to, and they asked for the last 4 digits of their Medicare number or all of their Medicare number.
Oh, okay.
Well, Medicare's never going to call you on the telephone and ask you those questions. If they are calling you to explain something to you, which rarely ever happens, they are going to already know your information. Right. So that is what we would call protecting your Medicare benefits from identity theft.
Okay.
Also, we have another watchword, which is called detect. And we're going to talk about a lot of that during our segment today. Many of our Medicare beneficiaries don't open their Medicare summary notices because they find them too confusing. Yeah. And therefore, there may be charges that have been charged against their Medicare benefits that were charges that they did not receive. And most of our seniors don't know the process for reporting. They can always call us if they feel something isn't quite right. We ask them to contact their provider, but if it's a provider they don't recognize, we don't ask them to call them. They can call us and we can help them with that issue.
And a provider being like a physician, a hospital or something.
A hospital, a home health agency, a durable medical equipment company. Please don't make it sound like everybody's out to fraud seniors, right, and we know that they are not. But as you well know, it only takes one bad apple to spoil the whole bunch, and everybody's scrambling to make sure that they keep themselves in line as providers. Right. Durable medical equipment, people calling on the phone saying, we can give you this supply or that supply cheaper than you can get it locally. Those are things that, we really try to tell folks that, is cold call selling to them. It may be legitimate, but it may not. So we can always help them with those issues as well.
So if, like I actually had a neighbor and his wife had a procedure at a local hospital. Mm-hmm. He came home to a very both her attorneys. Big bill came out from the hospital, and they said they actually looked at it in detail, which a lot of people probably wouldn't even do.
It probably frightens them too
Probably
much to
frightens
look
them,
at
very scary. And they look at it and they said, you know, I don't remember that procedure being part of it. They called up the hospital. They didn't really get the answer they were expecting. So would your department
Yes, we
be
can
that
help
number?
them advocate
Okay.
for that. We sure
Okay.
can.
Okay.
We sure can.
Well, that's good to know.
Yeah, because just because you went to the hospital and had a procedure, there are other procedures that go along with having procedures. Some you may remember, some probably maybe never happened.
Right.
And they may have unbundled codes and charged extra money for things that they really should not have charged.
And we're not saying that it was done on purpose.
Not at all.
It could have just been by accident.
You're exactly right.
And even if that individual is not paying for it out of pocket,
they are paying it through their Medicare benefits.
Right. And we are all paying for it.
You're exactly,
indirectly,
because
right?
it's taxpayer dollars.
Yeah.
Last year in this country, $68 billion was a low estimate that was lost to Medicare fraud, waste and abuse, and error. And that's a lot of money. I mean, if you take 50 states plus the 4 territories and you divide it out equally, that would be like over $1 billion for just North Carolina alone. And we have close to 1.6 million Medicare beneficiaries that call North Carolina home. So we have to make sure that we preserve the benefit for future generations and for their generation. And you don't want to be paying for something that you didn't receive.
Wow. 1.6 million?
1.6 million.
Wow. Is that growing?
Mm-hmm.
Yeah.
That's just what's been reported.
Okay, what steps should a Medicare beneficiary do if there are charges they have question marks about?
If you have question marks about it, first thing we say is, you may contact your provider and say, I'm sorry, I don't recall having this procedure done. Could you help explain to me a little bit about this procedure? I don't remember having this procedure done. You can always file an appeal. The new Medicare summary notices have the appeals section all in one piece, and it's very easy to follow. We're going to talk about the new redesign of the Medicare summary notice. They can file an appeal. They can call our office and we can help them file the appeal if they are unsure about how to do that. And we can also put a bug in Medicare contractors' ears that, an appeal is happening with this charge. This person didn't receive this.
Yeah.
And, you can let your provider know and say, we didn't receive this service, but we want to let you know we're filing an appeal.
Great.
And don't ever pay something.
Yeah.
Until you make sure that Medicare has either your appeal has been overturned, it has been rectified, and that you get a statement in the mail from Medicare, which is a Medicare summary notice stating, this has been reversed or these charges have been reversed, because getting sometimes money back from a provider may not be as easy as it seems.
Or timely. It could take a while.
That's right.
Very good. Tell me more about the Senior Medicare program and what kind of grassroots education would help us?
Well, right now we're really doing a statewide campaign as far as radio and holding public events across the state of North Carolina, teaching seniors the importance of reading their Medicare summary notice, really to encourage changed behavior.
Right.
I've worked for SHIIP for 15 years, and many times I see seniors walk into centers or Medicare beneficiaries walk into places and say, I don't understand statements, so I just don't even open them. I'm bringing them here. It's very important for people to open those statements. So we are actually going to see the film that we're providing today for the seniors out in the community and the Medicare beneficiaries that are under 65 out in the community, to teach the importance of looking where to look for on a Medicare summary notice to be able to spot things that may be an error or abuse or a fraudulent issue. We're going to see that film in just a few minutes. We also encourage folks, once again, to report that to us. Let us know what's going on with that so that we can help alleviate this problem. And it also gives the provider some education as well.
Right.
Perhaps they didn't realize that they couldn't charge something this way or something that way. And once again, we have wonderful providers in this state.
We sure
do. We
do.
really do. And we don't ever want them to feel like we're being big brother over them. But, seniors need to be educated. Providers need to be educated. Providers can have their identities, their numbers stolen.
Right.
And it's just as much on them as it is on the beneficiary.
Right.
So those are the things that we just want to try to keep things solvent.
I think it's great. Well, that can lead us into our video.
Great.
Look, here's a charge for something we didn't order.
Good catch.
I don't think you should ever pay for any bill unless you have
This is
first
a
made sure
national
that all the charges are correct.
Speaking of which,
That we
have you heard of the
incorporated
latest
in
Medicare
our
scams?
commercial.
This happened to my friend. A man came to her door claiming he was from Medicare. He had a smooth line about helping seniors with the high cost of their medicines, but she had to give him her Medicare number right then before the deadline. Well, when she got her Medicare summary notice, it was full of charges for services she hadn't
They pass those
received.
cards out like that.
Turns out this guy was a scam artist.
They pass out their
Medicare already has
numbers
everyone's
like that.
number.
Scary.
They wouldn't need to ask
Tell
for
when you
it.
go to the
Scams like
doctor.
these hurt every
Put your Medicare
taxpayer,
card in here
draining
and turn it
billions
face
from
down and say
Medicare and
somebody
making it
behind
harder
you
for
can't
people
see.
like us to get the health benefits we're entitled to. So I did something about it. I joined the Senior Medicare Patrol, where I work with other volunteers to teach my neighbors how to protect their Medicare numbers, review statements to spot false charges and detect errors, and report suspected fraud.
Hello, I'm North Carolina Insurance Commissioner Wayne Goodwin. Every day, Medicare beneficiaries become victims of healthcare fraud, many without them even knowing it. In fact, about $60 billion of taxpayer money is lost to Medicare fraud, waste, and abuse every year. In this video, you'll learn more about Senior Medicare Patrol and how you can help fight Medicare fraud.
The mission of the Senior Medicare Patrol Program is to teach fraud prevention to the 1.5 million Medicare beneficiaries in North Carolina. Fraud can occur in many ways. A healthcare provider bills Medicare for services you never received. A supplier bills Medicare for equipment you never got. Or someone else uses your Medicare card to receive medical care, supplies, or equipment. The Senior Medicare Patrol Program has 3 key watchwords: protect, detect, and report.
You can make a difference by actively protecting yourself from Medicare fraud. Treat your Medicare and Social Security number as if they were credit card numbers. Never share them with a stranger. Medicare and Social Security do not call or visit you in order to sell you a product. We suggest you don't carry your card unless you actually need it. Only take it to doctor's appointments, to the hospital, or to the pharmacy. Afterwards, it's a good idea to record your doctor visits, the tests you received, and procedures that took place in a personal health care journal or calendar, and store all of your receipts and information, bills together in a safe place. But even when you do everything right, you can still be the target of a scam. So how do we detect Medicare fraud?
Detecting possible fraud starts with one simple step: opening your Medicare summary notice. Oftentimes, people don't open their Medicare summary notices or review them for accuracy. It's very important for you to open these Medicare summary notices, or MSNs, as we will talk about today. A Medicare summary notice is a report of the services that were rendered against your Medicare claim number. These statements come once a quarter in the mail or every 3 months, or you can sign up at mymedicare.gov to review these claims at any time. Medicare summary notices are not bills. This is not a bill, but it is a detailed account of the services that were rendered against your Medicare claim number. The federal government is in the process of redesigning the Medicare summary notice. The old and the new version look a little different, but both contain the same important information. Today we're going to review 2 Medicare summary notices, one for Medicare Part A, or hospital insurance, and one for Medicare Part B, medical insurance. Whether you're reviewing a Medicare Part A statement or a Medicare Part B statement, it is important to review your personal information. On the first page, you should find your name and address. Make sure that both are accurate and up to date. You should also find your Medicare number. It should match the number on your Medicare card. Note that your full number will not be printed, just the last 4 numbers and the letter. If any of this information is incorrect, contact 1-800-MEDICARE. Now let's look at the claim information. We're going to start with Medicare Part A. Services that are rendered Medicare Part A would include inpatient hospitalizations, rehabilitation at a skilled nursing facility, or other similar services. You'll find the date the services were provided and the name and address of the hospital or office that provided the service. The doctor's name should be the name of the doctor that referred you for the service. The address shown is the billing address, which may be different from where you received the service. The first column shows the number of covered benefit days you used during your hospital or facility stay. The second column tells you if Medicare covered the stay. The third column shows non-covered charges. If there are charges listed here, all or part of the charges for the service were denied or excluded by Medicare. You may be billed for any non-covered charges. The fourth column shows the amount Medicare paid your inpatient facility for your deductible and co-insurance. The next column shows the maximum amount the provider may bill you, including deductibles, co-insurance, and non-covered charges. Medicare Supplement, also known as Medigap policies, may pay all or part of this amount. If there are any letters in that last column, there will be more explanation about this claim in the Notes section. Now, let's take a look at how the claims information is presented on a Part B Medicare Summary Notice. A Part B Medicare Summary Notice will list professional services, such as doctor fees, laboratory services, ambulance services, or other health-related charges. For each claim, you'll see the date the service or supply was received and your doctor or provider's name and address. The address is the provider's billing address and may be different than the address where you received the service. The first column shows if Medicare covered this service. The second column is your provider's fee for the service. The third column is the amount a provider can be paid for a Medicare service. It may be less than the actual amount the provider charged. Your provider has agreed to accept this amount as full payment for covered services. Medicare usually pays 80% of the Medicare approved amount. Next, you'll see the amount Medicare paid your provider. Again, this is usually 80% of the Medicare approved amount. The fifth column shows the maximum amount you may be billed. This is the total amount the provider is allowed to bill you. It can include a deductible, co-insurance, and other charges not covered. If you have Medicare Supplement insurance, known as Medigap, or other insurance, it may pay all or part of this amount. If there's a letter in the final column, go to the Notes section of the Medicare Summary Notice and find the corresponding letter to read more information on this claim. As you review this information, you should ask yourself some important questions. Do you recognize the name of each doctor or provider on the statement? Did you have an appointment on the dates listed? Did you receive the services or supplies listed? If you've already paid the bill, did you pay the right amount? Keeping a healthcare journal, as well as saving your receipts and bills, can help you answer these questions. If you have been billed for Medicare services that you did not receive, or if you suspect that a provider is involved in Medicare fraud, please report it immediately.
If you disagree with a coverage decision, payment decision, or payment amount, you can file a written appeal. Just go to the appeals section on the Medicare Summary Notice and follow the instructions. But if you suspect fraud, abuse, or waste, contact us, the North Carolina Senior Medicare Patrol Program, at our toll-free number 1-877-996-2767. Our services are free and confidential. If you think you've been charged for medical services you did not receive or for medical equipment that was not ordered by your doctor, give us a call. We can help. Together, we can protect, detect, and report. Don't be a victim. Help stop Medicare fraud.
Great. Well, that was an interesting video, I must say. Well, tell us more. In the video, it talks about filing an appeal
That's
as
right.
part of the process. Tell us more about that, if you could.
Really what we need for the beneficiaries to do is to make sure that they have their Medicare statement that they feel that is incorrect. They will need to sign a release for us that we will be able to help them file an appeal on their behalf. We also will need to know what their dates of service were, as well as any secondary insurance that they have. If Medicare paid primary, then the Medigap policy may have paid secondary.
Okay.
So you're filing an appeal on the Medicare summary notice. We help you with that, and then that in turn will reverse those charges on the Medigap policy as well. So we basically need to build a case. Like you were going to go to court, we have to help. They have to help us build a case and let us know that they did not receive those services and things of that nature. So we can help them do that.
And is there any cost involved in any of this at all?
No, our services are completely free and confidential. We receive our funding through the United States Congress, through the federal government, through the Administration for Community Living is where we receive our funding from to operate. And there is a SMP program and a SHIIP program in all 50 states, including the 4 territories. I say that because I know that we're in Charlotte, Mecklenburg, and a lot of folks will come to Charlotte to receive their services, or you may be going to South Carolina to provide services. So there is a SHIIP and SMP program in all 50 states, and we do operate in the same manner.
Okay. Huh. Tell me more about well, you brought some things with us today.
Yes, I did.
So tell us more about that.
Our viewers will remember on our video that we talked about the importance of protecting their Medicare benefits from identity theft.
Right.
And not giving their number out to everyone. It was, we saw the lady in the advertisement gave her number out, and the man just copied it down and just loaded it up with charges that she didn't receive.
Right.
So what we have is what we call a Medicare card holder. If folks want to call us, we can send this to them free of charge.
Okay.
Of course, we suggest that you put your Medicare card in this card holder with your number facing the back solid piece, so that the clear part is the only thing that has any writing on it, but it won't be your Medicare number. We really encourage you to use that. Keep that turned upside down. Even when you go to your provider, take it out and keep it turned upside down, because not only is it your Medicare claim number, it is also your Social Security number, which I'm sure that you have heard many of our other guests talk about forms of identity theft.
Right.
This can happen that way.
Right.
Make sure that you keep this guarded and in a safe place. In fact, you don't have to carry it with you every day unless you know you're going to seek the services of a provider.
Okay.
Because if you lose your wallet, it's just a big deal. It
Yeah.
really is a big deal. So, but if you know you're going to seek the services of a provider, or you're going out of town, even if you're locally here and you don't have your card with you, they're still going to treat you if you get sick.
Okay.
Okay. Also, we wanted to also talk about the importance of keeping a healthcare journal. We talked about that on the video. It's very difficult for us to remember what we had done 3 or 4 months ago, and those statements only come out once a quarter. We encourage our seniors, and they can call our office at 1-877-996-2767 and receive a healthcare journal. This is one thing that we ask our husband and wife providers that they don't share with one another. We don't need Fred's charges in with the same journal as Mary's. That's the one time it's okay to keep something separate. So keep that Medicare. It's just like your checkbook journal.
Yeah.
Keep that so that you will know what charges you have had incurred against your Medicare account. When your bill comes, you'll see what tests you've had run. And it also will help you when you go to new doctors or new specialists, and they will say, when did you last have this test run? You'll have it. It's your own personal health care history.
And you say that statement comes out once a quarter?
Once a quarter, unless you sign up and you're technologically savvy to receive it at mymedicare.gov. You can sign up and track your claims online. But you really want to try to keep up, even if you track your claims online, with what you had done, and you can take this to your doctor's appointments as well.
Now, if I've filed for an appeal and I get my statement on a quarterly basis, will the the status of that appeal show up on the statement?
It
as well?
should.
Okay.
It should show up on a statement, and you should receive notification from CMS, Centers for Medicare and Medicaid Services, that oversees the appeals as to what stage that appeal is in. So,
And how many does your department, if you had to, rough estimate, how many are you dealing with a year?
probably several hundred,
Really?
at least.
Wow.
A lot of them are complaints
Okay.
that we receive that don't go as far as an appeal process, but many of those are overturned before it actually has to go to an appeal process.
Right.
Yeah, we are part of the claims tracking for appeals, and we don't hesitate in helping those seniors. If they feel like they have been signed up for something that they didn't understand, or if they feel that medications have been put on their Medicare Part D, we're getting ready to go into annual election period for Medicare Part D, and they say, I've never taken this pill in my life. People say, oh, well, if my insurance paid it, why do I care? Oh, yeah, you do care, because that's going to put you into the donut hole quicker than what
Right.
you want to know. So, you want to make sure that services, you won't pay anything on your Belk's bill or your Sears bill that you didn't receive. Don't pay it on your Medicare bill.
But if it's a Medicare provider, just generally speaking, and it's on that bill, let's say in its ambulatory service and it's $150 showing up on the bill, is it safe to say if it's a Medicare provider, Medicare has already looked at that
Probably.
cost in advance?
Yes, they have.
You can still question and
Yes,
appeal it.
of course,
but, yeah,
yes.
Okay.
But if you didn't receive those services, or you didn't go anywhere to near that office that day, even if they're a provider of yours, then there might have just been a simple billing error on the provider's end.
Right. Well, are there any other current scams out there we should be aware of?
Well, people calling and stating that they have already been paid for a alert monitoring system for them, and just make sure that they're having Phil's number, and Phil, give me your number,
Right.
and it's all free to you, and they're going to come in and charge it, and
Right.
that's a scam. No, there's no free service. Sorry.
Nothing comes totally free, right?
No, sir.
Well, Stephanie, I really appreciate you coming here.
You're certainly welcome.
Especially a drive from Raleigh and all.
Just happy.
tonight's
Happy to help
program.
our friends in Charlotte and Mecklenburg.
And again, what's the telephone number in case they need to call?
1-877-996-2767. We're there Monday through Friday from 8 until 5. And you will speak to a live person. You will not be transferred through a system that you have to navigate a menu.
Great. Stephanie, thank you very much.
You're welcome.
Our guest from North Carolina Senior Medicare Patrol Program Coordinator.
That's right.
And she's taught us a lot both through the video and through conversation tonight to our readers or our viewers who are watching tonight. Thank you very much again for watching tonight. Again, my name is Phil Koch. Have a good evening.